I'd like to introduce Dr. David Borenstein from New York City in the US. Thank you for joining me, David.
Hi, thank you, Linda.
Now, since we last spoke, it's quite a few years ago now, and your experience of LDN, I know, has improved greatly. What's been happening with you and LDN?
Well, what's happening is I've seen a tremendous growth in the number of people who want to try the LDN. I've seen a lot more awareness of LDN, and as a result, I've certainly increased the number of patients that I've prescribed LDN to. And this has given me a lot more experience, not only about efficacy of LDN, but also about possible side effects and how to deal with these issues as they come up. I'm finding very, very, very encouraging results for a wide range of treatments, and a wide range of autoimmune diseases and other diseases that LDN can help. And this is great news because this gives us another very powerful tool in which to treat our patients with.
Mm-hmm. So what conditions are you seeing mainly?
The main conditions I'm using LDN for currently are gastrointestinal and neurological. So patients with multiple sclerosis and those with Crohn's, inflammatory bowel disease, irritable bowel disease, colitis. This is my major use of LDN. And the results are, nothing short of amazing. I get many patients who are telling me, I've been in LDN for years. I've had no relapse of my MS. I've been on LDN. I've had no relapse of my Crohn's. My gastroenterologist did a colonoscopy, and my colon looks amazing. And I'm hearing this over and over and over again. And this is an amazing thing because you have the ability to quite easily change someone's life. I'm also finding recently some positive results with patients with fibromyalgia, and lately even with Lyme disease. So this is extremely encouraging because only lately have I been using this treatment on Lyme's patients. So while this is not a cure, it's another tool in our arsenal for treating fibromyalgia and Lyme's disease.
Mm-hmm. Can I just ask, when you said about side effects, could you tell us what side effects people have reported to you?
Well, the major side effects people have are with insomnia, the vivid dreams, some occasional gastrointestinal issues. Those tend to be the biggies. Some people get an exacerbation of some of their yeast issues. So we, are able to handle it. We can recommend certain supplements, certain techniques. We can change the way we give the LDN, or transdermally, for example, as opposed to orally. So, with a lot more experience, we have ways in dealing with the possible side effects. That being said, the side effect profile of LDN is quite low, which is quite different than a lot of other medications that are used to treat the same things we treat LDN with. There's no immunosuppression. There's no lowering of white counts. So overall, LDN has a very low side effect profile, but we know how to deal with them, and that's very important.
Mm-hmm. And I know you listed some conditions that you prescribe LDN for, but do you have any really unusual conditions that you hadn't treated before?
Well, one of the protocols that I've been using for LDN is in the treatment of pancreatic cancer. I just had a recent patient with pancreatic cancer. And the amazing thing, I was using LDN with the alpha-lipoic acid intravenous twice a week. And the patient was doing extremely well for several months. The tumor markers of the patient actually normalized. The problem is when you're doing this protocol, many times you have other things that are interfering with it and other practitioners prescribing other things, and you don't know exactly what's going on. However, the patient was doing well, then stopped the alpha-lipoic acid drips for about 2 weeks, and unfortunately there was a relapse. However, the promising thing about this is that the length of time this patient was with normal tumor markers, and that this is kind of unheard of in the treatment of pancreatic cancer. So while the patient did have a relapse, the length of time was certainly longer. The survival was longer than what the textbooks say. Mm-hmm. And that's a good thing. That's a good thing.
Where do you see LDN going?
The news is that there's a lot more awareness of LDN and a lot more people who know about it. And there are more and more doctors who are willing to prescribe it. That's the good news. The not so good news is the vast majority of patients and doctors still either don't know about it or are unwilling to prescribe it. I think there's been tremendous progress, especially in the last few years. I think there's a long way to go.
Mm-hmm. Well, I'm just pleased that we have open-minded doctors like yourself on board who are prescribing LDN for their patients. As a patient myself, I'd walk to the end of the earth to continue taking LDN. Is there anything else you would like to say?
I'd like to say is that if you are a patient and you really want to try LDN, I'm going to strongly encourage you to do. There's very few treatments that are A, inexpensive, B, have extreme potential, and C, have such a low side effect profile. It's a no-brainer. If you think there's a remote possibility that this will work for what you have, try it. You have nothing to lose and everything to gain.
Thank you.